Hello everyone. Today we will talk about blood components. So if we centrifuge blood, the components of blood get separated. So at the bottom we have the heavier component like the red blood cells. At the middle we have the white blood cells and platelets, and at the top we have plasma. The lowermost component, we call it hematocrit or packed cell volume, which is usually 45%. It contains RBCs packed up with no space in between. The middle layer is the buffy coat, which is less than 1%, and it contains platelets and WBCs. The uppermost layer or plasma is usually 55%, and it contains plasma proteins, electrolytes, organic nutrients like glucose, amino acid and fatty acids, organic waste like blood urea, nitrogen, and also dissolved gases like oxygen and carbon dioxide. Now hematocrit. Hematocrit is made up of only RBCs. RBCs lack nucleus and organelles, and RBCs has got biconcave shape, which helps RBCs to adopt parachute-like shape and pass through the narrow blood vessels like capillaries. Now here are the causes of high hematocrit and low hematocrit. So the physiological causes of high hematocrit are dehydration, high altitude and smoking, and the pathological causes of high hematocrit are polycythemia rubra vera, erythropoietin secreting tumors like hepatocellular carcinoma, renal cell cancer, autosomal dominant polycystic kidney disease, hemangioblastoma of cerebellum, gastric and pancreatic neoplasms. On the other hand, causes of low hematocrit are excessive fluid intake, nutritional deficiencies like iron deficiency, folic acid deficiency and B12 deficiency, aplastic anemia, radiation and chemotherapy, chronic kidney disease and chronic autoimmune disease like rheumatoid arthritis. Moving on, platelets. Platelets are basically cell fragments, and they come from a large cell called megakaryocytes in the bone marrow. Platelets primarily help in the primary hemostasis or platelet plaque formation. Moving on to WBCs. So WBCs, as we all know, that WBCs are granulocytes and agranulocytes. Under granulocytes, we have neutrophil, which is the first line of defense against any foreign microbial invasion. Then eosinophil, which helps to combat the parasitic infection, and basophils has got role in allergic reaction. Under agranulocyte, we have lymphocytes and monocytes. Lymphocytes are of three types: T cell, B cells and natural killer cells, and they helps in adaptive immunity. Monocytes are basically phagocytic cells. Moving on to the plasma proteins. In plasma, we have the major protein called albumin, which constitute about 55% of plasma proteins, and their normal level is 3.5 to 5 gram per deciliter. It is the major plasma protein, and the major function of albumin is to maintain the colloidal osmotic pressure. Other functions of albumin are: it acts as a carrier for calcium, lipid and steroid hormones. Next, globulin. Globulin constitutes 38% of plasma proteins, and normal serum level of globulin is 2 to 2.5 gram per deciliter. It is larger than albumin, and its main action is to act as a carrier protein for fat-soluble vitamins, metal ions, and this function is for alpha and beta globulins only. We have another component of globulin, that is called gamma globulin. Gamma globulins are mainly antibodies. Alpha and beta globulins are synthesized from liver. Gamma globulins are synthesized from the lymphoid tissues. Another important plasma protein is fibrinogen. Fibrinogen constitutes 7% of plasma proteins. It helps in secondary hemostasis as well as primary hemostasis. Other important proteins in serum are regulatory proteins, which helps in the regulation of gene expression, and clotting factors, which helps in the conversion of fibrinogen to fibrin in the secondary hemostasis. Now moving on to hypoproteinemia. When protein concentration decreases, we call it hypoproteinemia. Normal serum protein concentration is 5 to 8 gram per deciliter. And if protein concentration is less than 5 gram per deciliter, edema develops. Blood loss, protein losing enteropathy, severe exudative skin disease, severe burns, glomerular diseases are the major causes of hypoalbuminemia due to increased loss. Decreased production of albumin can occur in hepatic failure, starvation, gastrointestinal parasitism, malabsorption, and exocrine pancreatic insufficiency. Failure in the formation of gamma globulins causes immunosuppression or immunodeficiency. One of the examples is Bruton's agamma globulinemia. Next, hyperproteinemia. Loss of water, acute inflammations are the causes of hyperproteinemia. Increased beta globulin concentration can occur with acute inflammation. Concentration of severe acute phase proteins like C-reactive protein, complements, ferritin increase during acute inflammation. Increases in gamma globulin concentration are termed as gammopathies, which may be monoclonal and polyclonal. Multiple myeloma is an example of monoclonal gammopathy, which is due to proliferation of single clone of B lymphocytes. Now moving on to AG ratio or albumin globulin ratio. It provides a systematic approach for the interpretation of protein values. Dehydration with loss of water results in hypoproteinemia but without a change in albumin globulin ratio. Decreased albumin globulin ratio due to decreased level of albumin or increased level of globulin. Increased AG ratio. Albumin is usually not produced in excess. Decreased globulin physiologically seen in neonates due to failure of passive transfer of cholesterol antibodies and failure in the formation of gamma globulins causes immunosuppression. Thank you.